All right, we made it to Friday. We want to welcome all of you into Coronavirus Inside the Arizona Numbers, a daily look and a deeper dive into the numbers as they represent themselves here in Arizona. Of course, we want to welcome all of you in from wherever you're watching. Drop a message in the comments where you're watching right now. Hopefully, you can take some of the information here and apply it to your state if you're outside of Arizona as well. We want to jump right into this today. We're hoping to have these numbers a little more stable, a little more solidified as Sonora Quest, one of our major providers here, works through their backlog of cases and gets the results out to people. So I'm Katie Rammel. Alongside me here, our data guru, Garrett Archer. Let's jump right into that summary page, Garrett.
Yes, let's do that. So here is the AZDHS summary page as we start every day. 174,000 cases in total confirmed throughout the entirety of the pandemic, and 3,694 deaths. So that's about 3,700 deaths. Today's report, 3,200 cases off of 20,000 tests. So this is our second highest number of PCR tests that we've had since reporting has began. That is, like you said, the indication that Sonora Quest is processing their backlog. The most exciting number, well, let's go through the bad news, of course, today. 68 deaths reported, and just to remind everyone that those 68 deaths, as is normally the case, do not occur from the last 24 hours. They do occur over a period of time, sometimes as long as 10 days or so. So that's just something to take in consideration every time you see these numbers. That 68 deaths, or any number that appears on that right there, is not what happened in the last 24 hours. So to get to the most exciting number on this page today is this PCR percent positive. It is showing 14.5 today. Yesterday, it was showing 14.6. And I know a lot of people would look at it and be like, oh, tenth of a point, that's not a lot at all. That's not a big deal. But, you know, the fact that we have over almost 1 million tests and 3,000, sorry, my daughter is, something's going on with my daughter. I apologize.
Connor, go check on her. We'll stay on this page. If we can take this page full, Garrett, actually, if you click on Maricopa County for me while you go check on her for a second. The Maricopa County numbers are pretty interesting today as well, because we had 117,000 cases. We've passed that mark. Now, keep in mind, Maricopa County has about 4.4 million people who live here. But I wanted to highlight the county, especially here today, because we're the fourth most populous county in the nation. But we steadily saw our numbers climb so that we climbed right up into the number 2 spot for counties across the nation, even though we didn't have the population to match it. It is an important day and a noteworthy day because Miami-Dade County has now passed us. They have moved back into, well, up into the number 2 spot, and Maricopa County is now back in the number 3 spot. So we're seeing that, not that we're declining in any way, but that other counties are climbing back above and past us. So, Garrett, it sounds like you're back. Hopefully everything's okay with your daughter.
Yes, there was a scary bug.
Okay, well, you know what? There's a scary bug at any age, so I definitely understand that. Both Garrett and I are working from home as we socially distance, and our studios are limited to about less than 10 people on a normal day inside the studio. It's amazing that our engineers are able to help everybody continue to have a broadcast on air at 4, 5, 6, 10. We also broadcast out of for the CW as well. So a lot of news comes out of our newsroom, and we're still able to do this from home. So it's pretty incredible. All right, I was just mentioning, Garrett, as you walked away, and I don't know if you noticed this today, that Miami-Dade passed us for the most cases.
Yes, so, I have noticed. I was watching how Miami-Dade is having a pretty significant increase in cases right now. Yes.
Yeah. So of note, because we're back in the 3rd spot for as far as counties go, but we were looking at that summary page and looking at the numbers in Maricopa County, and of the 68 deaths that were reported here to us today, 43 of those were here in Maricopa County, which is not uncommon when you see that large populace there.
Yes, I do have, and I can, since we're talking about the deaths, I'm going to stop screen here and share another screen. This is the epi curve. So this is the date of occurrence, and what this will show you once. Oh, hold on a second. let me do that again. My apologies. What this shows you is the actual date of occurrence. So we will, let me just pop this up. Okay, here it is. And so what I want to show you is that this dark blue line is what has been on the death. Oh, this is test. Let me go to, sorry about that. Okay, so here's the death epi curve. This is the dark blue line are deaths that have been on the curve since yesterday and have been since, as they're filled in. The light blue are adds from today's report. So this is about around those 68. You can see there were some subtractions on certain days. That does happen every once in a while. When that happens, it's because the epidemiologist over at the AZDHS or over at a county department are bringing the deaths back one so that they can verify. It's typically to verify the date of death. So they were given something, they had some conflicting information, so they pull the death out and then they reinsert it at another date. So that does occur, but you can see right here the majority of the deaths did occur over here in about the last 7 to 9 days.
I see Evie's just posting, it took me 16 days to get my results. Evie, I don't know how you made it that long mentally. That is a really long time to wait to hear. I think I waited 3 days and I was feverishly checking the online portal to see how quickly I could get the information. Negative. Well, that's the good news in all of that.
And on that part, we can see the same curve using for the tests. So we can see what he's talking about. So today we can see that the majority of the tests that Quest Labs put into the system today came from about the last 10 days. There are some from 14 days back, but really it was this last week. Kind of early this week and late last week is when the majority of the tests have been processed. So those people that went and took a test in that period of time, those are the ones that are getting either confirmed positive or negative at this point.
Yeah, just a long time to wait. Cutler's saying I waited 15 days. My gosh, I cannot imagine. Hopefully we won't have any sort of backlog like this again. SonoraQuest is installing those new machines. They say that they'll be able to run with 2 lines up, that they'll be able to run 60,000 tests per day. That is a huge number if they're able to get all that, all those machines plugged in and up and running, which is what they're hoping for at this point.
Yeah, and that will be obviously, as the governor said on his press conference yesterday. He did mention that the demand for testing right now is down. They did have 3 FEMA, I think he said it was FEMA sites set up with 5,000 capacity a day, and they didn't reach those capacities. So at this very moment, testing demand is down, but we have to understand that a lot of things that they're doing at Quest Labs and elsewhere is to basically get ready for the future. So if we begin to see another flare up and testing demand begins to increase again by what was truly exponential numbers in late July, that they will be able to process those tests at a much faster rate than they did this time. As Dr. Chris said, one of the reasons that we do have the backlog is because Quest Labs didn't have the reagents. So they had this big, massive line building up because they weren't able to get the reagents. And she said, well, this new lines, there's no issue with these reagents. So we should not have the same issue if testing demand ramps up like it did in late June, early July.
Yeah, that was something that we've talked about on here before, and it was interesting to hear her talk about it just a little bit more yesterday. Okay, so that should help to sort of shore up the confidence in our not number if it was processed after they got these numbers in today. I noticed on RT Live that they had said their poll on the data was at 8:21 a.m. So would you say we should wait till tomorrow to say that is a more stable number because perhaps they didn't get the information from today's?
If they pulled at 8:21 a.m., they should be okay with today's number. The numbers usually pop up, and they've been fairly consistent anywhere between really 8:10 to 8:20 at this point. So almost every time in the last several weeks, it's been prior to 8:20. So if they did pull it before that time, then they should have these new results. And here we're looking back at the new the RT Live site. And here we are, Arizona at 0.91. We are back at, and I'll change my screen color so everyone can see it a little better. We can see that there's a whole lot of green here again, and Arizona is back at the second best R naught rate. And with the error bars in consideration, we have the lowest sort of estimate in the country right now as far as, well, it could be as low as 0.66. Vermont, it's 0.67. So ours is slightly better, but the way statistics works, they say it could be as low, but we're pretty sure that it's going to be this 0.88 or this 0.91. So technically, Vermont does have a better R naught than us right now.
Yeah, that range again, 0.66 all the way up to 1.08. Is that what it looks like today?
0.08. Yeah. So technically, that means that the best guess of this formula is that while in most of the time it thinks that we are not growing in transmission, it does say that based on our estimates, it could still be growing in transmission because it could still be over 1.
Yeah. I want to get to some of the questions. Naomi's asking, do these numbers make any sense? Naomi, let us know specifically what we can help sort out for you. If this term RT or R naught makes no sense, which is something we're all learning the new vocabulary here if you're not a data analyst. It's the measure of how fast the virus is growing. It's an average number of people who become infected by an infectious person. So in essence, an R naught or an RT is just how quickly it'll spread in our community. Below a 1 is good. That's why we're in green. Above a 1 is red. And we were in red for a real long time. So that's why that number is so important. Veronica writes, is there a way, Garrett, to quickly calculate the approximate number of people hospitalized based on the number of positive daily reported cases? So what we're looking at, we said at 4%, right, in Maricopa County end up hospitalized. Would that then be the best percent instead of us calculating it to going to the real numbers? Where would you suggest for that?
That's a good question. Let me see if I can get back to you with a better estimate. There are people who have done that. I haven't added that to my calculations, but I can try to find that one for you. What I know is that when you look at these hospitalizations, any case numbers are coming out right now that are on the epi curve, not the reported curve, but the epi curve. The hospitalizations, any hospitalizations that come from those cases are likely going to appear in the next in about 2 weeks. So that's sort of how things work. It goes case positivity, 2 weeks about hospitalization. And this is, of course, in worst case scenarios, 2 weeks out hospitalization, and then 2 weeks out death. And that is, like I said, of course, a worst case scenario. But that is sort of the when you look at the lines of cases, tests, or cases, hospitalizations, and deaths, that's sort of the trajectory it follows. We've talked about that with how deaths usually have a 27, 28-day lag. And that's why we have been seeing a decrease in deaths, because our case numbers, our increasing cases was going up so much in early July. So now by the second week in July, our case numbers started to decrease. So we should technically begin to see a decrease in deaths, going forward here.
Yeah, it was one of the reasons, I think, why it was so difficult to sort of present the news on results starting to increase, because people couldn't see it yet unless it was someone that it affected them or it affected their family, because you didn't see the packed hospitals yet here. You didn't see the caskets and high death numbers and refrigerated coolers that were showing up downtown to hold bodies. It just didn't seem real to people. And I think that just hearing the case counts was difficult. And that's something that we always have to remember along this path, is that, a 2-week lag in each of these numbers. So when you're running different numbers, you gotta realize where you are in this sort of track, if you will.
Yeah, and it's one of the difficult things for all the decision makers, is that, what's happening right now, we're not going to find out truly for 2 weeks what's really going on out there in the open right now.
Yeah. Let's see. I'm wondering if we can answer this for Al. Al writes, crystal ball time. Will this number ever go to an insignificant low level? Were we at a significantly low level a year ago if it would have been measured? So I'm thinking he's referring to the
R naught, I would assume.
Yeah.
That's a great question. I don't like to do crystal balls, especially on, I'm an elections analyst by trade. So doing an estimate or a forecast on what is already a forecast on a health statistic is a little uncomfortable for me. But what I can tell you is that, pretty much it will go down, obviously, And when it does go down, it's going to be because of one or two things. It's going to be because we do have a vaccine or because we have herd immunity. I don't know enough about any of those two things to tell you, oh, we hit herd immunity at a certain point. I wouldn't ever estimate that. But what I can tell you is that it will go down eventually, and it's going to be because of one of those two things.
Yeah, and of course, all the conversation and concern around herd immunity is how long do the antibodies last? If they're out of your system and you're able to get it again and again and again, then how many times are we looking?
Yeah, and that's a great point, because that also will take into consideration eventually. I mean, this RT number, this R naught number, is based off of case growth and probability of further case growth. So, if cases are going down to insignificant levels, if we're testing 30,000 a day and getting 5%, 3%, 2% percent positives at that point with appropriate contact tracing, then I could imagine that the RT would at some point get to the point where it's not really statistically significant anymore.
Stephanie asks, what are the hospital numbers? We could get to that for Stephanie. She goes on to write, as you pull it up, Garrett, are we increasing with ER visits again? And if so, how many days of an increase would be cause for worry?
That is a great question. And the answer, thankfully, is we are not increasing our emergency visits today. So, and I am with you as far as I was sort of looking for another day or two. If it was going to go up for another day or two, I was going to start getting a little worried because as we've kind of seen, emergency room visits are probably the best leading indicator we have of what's really going out there. And having this number sort of go back down, and it might go back up again tomorrow, and it might go down again, but now we're seeing that it's finding fluctuation and it's not establishing a trend line, and that's okay for us right now. You know what I mean? I mean, everything we do is a waiting game with COVID-19. So the fact that it's a fluctuation is okay for right now.
All right. What are some of the other numbers as far as hospitalizations on that page? How do they all look? Wow, that's a great start. Right?
Yes, we are nearly under 2,000 COVID-19 positive or suspected patients in the in acute care beds. We're almost under 2,000 there. We're at let's see, we're at 2,302. So we've got a little bit more to go to get under that. We were at the top. This is the peak, 3,517. And we're at 2,302 right now. Ventilators also went down today. We're at almost under 500. ICU beds, we're at 719. We haven't been that low since about the 1st of July. And then the discharge number, 356, went down a little bit, but that one doesn't really, you can't use that as a trend that much. And then we already talked about the ED number, and the intubations also down to 80.
Wow. So some better news on all of those fronts.
So, and just on the actual census numbers, some people ask me, well, why aren't the census numbers going down? Why do we still have 86% in the ICU when our COVID-19 patients are going down? And why are we still getting 84%? Well, I had a conversation with a doctor this morning, and they said, well, I mean, a lot of hospitals are also going to try to take care of those elective surgeries that they again put on hold when things were looking really dire a couple weeks ago. So they're trying to reschedule these surgeries and all these other things they have to do. So they're keeping their census numbers up right now, but their COVID-19 numbers are going down. So we just have to understand when that we're looking at that, say, oh well, there's a difference between that. One's going down and one's staying the same. And why is that? It's like, well, that's completely appropriate. This number is COVID agnostic. It's literally just a bed count in the hospital. It just means that it could just mean that they're just adding more people.
Yeah. Okay. One of the other questions that we get often on here, and I want to be sure to take time for it, is to talk about kids, because so many people are making decisions about their kids. We have Meet the Teacher tonight from our house, and we're doing it from home, just like a lot of families. So, but I know families out there are still making decisions on how to navigate this whole schools thing, and they're looking toward the number of children who have coronavirus here in our state. You said, is it the fastest growing demo right now?
It is. It has been for a couple days now. So it's growing at about a rate of 2.5% today. And that doesn't sound like a lot. And realistically, it really isn't that much, but it is the highest growing amongst the other age groups. This was the case back in May and early June. This was also the case that this group was the highest growing age group. And then it switched once we once we opened up the state. that shifted very aggressively to the 20 to 44-year-olds. Now, just also to take into consideration that even though it is a highest growing group, it's also the least impacted per capita group, age group in the state right now, by pretty sizable margins. So that's just something to just take into consideration as well.
And how many total, if you can sort of read off that section, just because I know it's so small for people on their phones.
Yeah, it's 20,689, and that's 12% of the cases. And that's remained at 12% for quite some time.
All right, Garrett, thank you. I know that's something I want to touch on every single day, because I know, like Marty writes in, if it's your kid, it sounds alarming. That's for sure. You know, this is affecting those families personally, and we've heard from some of them. So we absolutely understand how difficult and concerning and alarming, as to use the word Marty used there, it can be. So it's something that we want to highlight for you each and every day right here, so that we can help you make those decisions. If you are having to make decisions about schools and you're confused on the plans, we have a section on abc15.com/schools. That's where you can find the very latest information. There's an interactive map. You can hover over that section to see what your particular school district, your kid's school district, your grandkid's school district, you can see what their plans are, or what their proposed plans are. They're changing by the minute, really. Our reporter, Daniel Lerner, is keeping everybody up to date and is so great with all of her contact with all of these schools to get the very latest information. But it's changing all the time. Let's see. Oh, Vanessa asked, I'm confused. Most of the testing sites are empty these days. Are these old test results? So even though the slowing is happening at the results site, Vanessa, we still had a big backlog here in Arizona for one of our largest providers who provides the majority of the test results, and that's the NorQuest. They're working their way through those numbers, so we should see it to be more stabilized across all fronts by next week, and we're hoping that's the case. So really good question. Hopefully, Vanessa, that clears that up for you. Kimberly writes, our testing site at the fairgrounds are always busy. Wow. Let me mention this too. If you want to get tested, it's so easy to figure out where to go. The website to head to is doineedacovid19test.com. Let me read that again. doineedacovid19test.com. It'll take you through how to register and where to get signed up. I've mentioned on here, I did the saliva test through ASU. It was so easy. You do need a cell phone number to put in your name and all your other information, but it's pretty quick. So Donna asks, did the August 17th day for schools to open, did that change? Donna, it sort of became not as important anymore, because they let each school district decide kind of their own situation. So you're not going to see places, you know, each school district is going to decide their own. So be sure to go to that website, our website, and hover over it, and you can see how the school district in your neighborhood is located.
I also want to address what you were talking about, the testing site being full. And so what I did is a friend of mine on Twitter, John Stone, who also tracks, he's very good at tracking the zip codes on COVID-19 for Arizona. He put together a map of sort of the West Valley. We saw, going back to that PCR backlog, we saw a large sort of inordinate increase in cases from the West Valley in the last couple of days. And that is attributable very likely to the test backlog and just the fact that this area is still sort of a hotspot. So as she said, you know, there could be very busy testing locations in these regions. So, you know, you look at this map right here, Glendale, for example, the growth for the last week has been 322. Right here in 85041, 328. You know, this has been sort of a hotspot area for COVID-19 for quite some time. 85033 had a growth of 384. So, you know, we still have areas of the state that could be experiencing longer test lines, higher case numbers. It's just that some other areas in the state, like for example, Navajo Nation, some of the other rural counties, and other areas of Maricopa County may be, you know, slowing down.
Okay, someone's asking, where can I register for saliva testing? Let me scroll back to your comment here. Where can you register for saliva testing? So this is through ASU. I'm not sure if you're watching us in Phoenix or in Tucson. In Tucson, I believe it's held at the LA Town Center. In Phoenix, it's going to be held over at the stadium, so State Farm Stadium. Sign up by going to the Arizona Department of Health site and click on testing, and then down below there's a little tiny log for the saliva testing. It takes about 5 minutes to get signed up, but you want to do it like right now, because I don't want you to leave us here, but you should go sign up right now, because the Saturday testing does fill up kind of fast. So keep trying if the site is glitchy. It was for me last Friday night, but keep trying, because people bow out all the time and change their appointments, and then you can jump in and get their appointment as well. So thanks for the question. It was so easy to do. It probably takes 20 minutes on the site in total. And while you're driving through the test itself, maybe 5 minutes. It's so quick, and then you get it back within about 48 hours. Mine was at the very end, tail end of 48 hours, or maybe a little bit more than that, but you get it back pretty quick. So that's the best way to go, I think. Let's see, Misty, are you saying everyone needs to be tested? No, you can get tested though. We're caught up enough that the governor's saying if you're curious, you can just go get tested. So that's kind of where we are standing right now.
Yeah, and the sort of the thought process around testing and the percent positivity is that, as the virus, with the R naught, for example, the more people in the community that are getting tested and the lower the number of percent positive, there's a better understanding of what the community spread of this thing is. So, that's one of the reasons why they're ramping up the ability to test 65,000 people a day, or whatever that number is, because so that if we get, again, like I said, if we get to another time when we need that ability, then it will be there.
Artemia is asking if we can see that map again, please. Garrett, did you just close out of it? Sorry.
I did. Let me pull it back up.
Okay, as you pull it back up, do we know how he put this together? Is it based on your home zip code? I know people are going to ask that, or the place that you're testing, because I know that some of the higher need areas in the valley got those testing sites.
So it is going to be based off whatever is sent to the AZDHS. So if you are testing and you give them your zip code, then it will be reflective of your zip code. If you are in a hospital, or you are, if the person who has it is someone who doesn't have a home address, then it could be the hospital zip code.
Mm-hmm.
If for some reason there was an error or something and they don't have complete information yet, it may be the testing site zip code, which will then be changed as soon as they get the record complete. So it could be a number of things. I would surmise that the majority of these are likely people's residential zip codes, but there can be some noise in this data.
Yeah. Kelly writes, right, get tested only because you're curious, then you count as a positive case. Kelly, I went and got tested. I did not count as a positive case. I signed up and put my information in, and I got back a negative case. So they're not changing anything. There's nothing going on like that behind the scenes. They're gonna give you a regular test, and you're gonna get your test results back. So if you're curious, go get tested. Go get signed up for it. Lana writes, where can I donate blood? I hear they do antibody tests. Lana, yes, they do. Both Vitalant and Red Cross will do a free antibody test when you donate blood. Go to their website, and you can click on 2 different ways to search, whether you want to search based on who's closest to you or who has the next available donation site. So you'll be able to see where you can sign up. They will test your blood for antibodies and then get back to you. It does take longer to find out the antibody information. It'll take like 2 or 3 weeks, but it is free. So that's one of the cheapest ways. It's free to go find out. Lee was asking about Coconino County. Can we give an update on how things look there?
Sure. Let me go to the Coconino COVID-19 page. Give me one moment. Okay. Let me see. Yep. Sorry.
That's okay. No, it's great. So as you're pulling this up, obviously each county has varying levels of information that they put out. But if you are outside of, we talk about Maricopa County a lot because it's the most populous, but you can check any county and see how things look, and we're happy to pull that up for you. We're showing Lee right now how things look there.
So Coconino County, 2,832 total confirmed cases. They added 13 from this report, which is dated, I believe this is probably today's report. And you can see Coconino County is one of the counties that does give a recovery number. So they say that 1966 people have recovered. And how they define that is right here: a confirmed case is considered recovered if they have not passed away for 28 days of the report of the illness. So that's how, and that's actually one of the ways that I used for my active cases as well. I took it from them. And then here we are. You can see most of this. There's some Flagstaff, 511 in Flagstaff West. East Flagstaff at 86004 is 576. Their hospitalizations are 530. It's been about that's kind of stayed stable for quite some time. And then you can see they also give case types as far as chronic illnesses. So you can say with chronic medical condition, 21% of the cases have been with chronic medical condition. And they do actually give a definition here on their site. And then they do have the high risk, which is the combination of the chronic medical conditions and the over 65 age group. So they have, Coconino County has a great dashboard if you're interested. I'll send it over to producer Cortland if he wants to put it up. I don't know if he did already.
That's great. Hey, Garrett, tell us once again, you said their measurement for recovery in Coconino County is 28 days beyond active illness?
No, 28 days from report of illness. So from the test collection date. So whatever the test collection date is, 28 days from then, if that case has not passed away, then it is considered a recovered case.
Oh, very interesting. It'll be interesting to see what the what everybody sort of takes on as what recovery can look like. Are you seeing that in any other counties that are using that metric to judge recoveries?
Most of the counties, believe it or not, they use because cases are done in investigation.
Right.
And a lot of the counties don't have a tremendous volume of cases, and so they're able to keep good tabs on the number of on the people that actually were tested positive. So the recovery numbers for most of the counties in the state are based off of when the investigation was closed. So they don't simply say 28 days. They say, we've finished your investigation. We've called you and said, hey, are you fine? And you said, yes, I'm fine. And so we close the investigation on our end. And so that is considered a recovered number. Coconino, one of the reasons why they give a estimate rather than a confirmed case number is because a large portion of their population is or at least the confirmed cases are from the Navajo Nation. And the Navajo Nation isn't obligated to or obliged to send them the same type of stuff that other counties, that other entities do. So just because of that, because of sort of that they do their own testing in the Navajo Nation, they do their own other things. So that just kind of makes it easier for them to do an estimate at Coconino rather than give investigation closures.
Yeah, and I want to stress one thing that David Bell just posted, and it's 100% true all day long. David, thank you for saying it. Recovered does not mean healthy. We can't stress that enough. So their definition for recovery doesn't mean that you're back to 100% health. This is for folks. There are folks that we've covered who are defined as long haulers who have been sick a long, long time. So David's exactly right. This does not in any way mean healthy.
Correct.
That's why it's been so hard to get a definition for recoveries.
Yeah, and that's why when I did, because we don't have one for the state, we don't have a recovery definition, and then states, the AZDHS, for the same reasons, is opting right now to not give one. But I did do an estimate on active cases. So this is cases using Coconino's metrics, saying how many cases are considered active in the state based off of the actual data collection. And what I have is there's a range as far as the confirmed cases, anywhere from 19,000 to about 63,000 cases in the state right now that could be considered active.
Wow.
So, and then again, this is based on the confirmed numbers. If you look at modeling, that number we've showed is much higher.
Yeah, I mean, in fact, Donna's just writing in, my daughter's in Nevada, got COVID, sick for 8 days, still positive, over a month now. She wouldn't be considered recovered. She's still fighting it. Absolutely. And Donna, this is why we talk about this all the time. It's so hard to come to a recovery definition or a healthy definition. I mean, this is a tough thing. And that's why, we got dinged so often working as journalists for not presenting a recovery number. This, exactly what Donna is saying and what David is saying, this is exactly why this was so hard. And it was exactly so hard to define what that is. So, and by the way, Donna, I hope your daughter has a speedy recovery. I know you have to be so worried about her. I'm assuming that you're here in Arizona and she's there in Nevada. So we send our well wishes to your daughter and to mom there. Oh, she says her BF2. He finally got tested negative. The entire household got it. That's the tough thing in all this. So Donna, we're wishing them all a speedy recovery there, and wishing you sanity, because I know how hard as a mom that can be to be thinking about your little ones sick, even when they're not little anymore. So thanks for sharing. Let's see, we're already, geez, getting close to the end of our time here. I had a couple questions about another county, and I think maybe it was Pinal County. How are they in reporting? I don't remember how they've been reporting.
Pinal County can be they had been spotty for a while. They've gotten much better in the last couple weeks. They are. We're just going to go to the AZDHS for Pinal County, just because it's just easier to do that. So I'll take you to the AZDHS's page, and we'll just click on Pinal County. And hold on? That was the zip code. My bad. Oh wait, no, that was the right one. Okay, I forgot that the zip code map is now in. Is on the site. It's not from somewhere else. So let's go over to the COVID cases by day. And we're going to have, this is the epi curve of cases. We're going to click on Pinal County, and you can see they have 7990 cases, but a lot of sporadic sort of jumping here. I think this has a lot to do with in Pinal County, because it's really not a smooth curve. It probably has a lot to do with the prison in Florence, and that's why we have these bigger jumps here and there, because that data would be included in these numbers. So and you can kind of see how it's gone there, and they are they're definitely on the downslide with everybody else right now.
Yeah, thank you for updating that. So, John, if you ever want to look at that, probably the easiest place to go is right there to the Arizona Department of Health site, and then you see that map there. You can hover over any of the counties and kind of get the very latest info on that. That's easy place to check, best place to check. All right, let's see. Carrie's asking about schools. If the age group is 20 and younger, how are schools going to know if there's an increase in cases of school age kids? So Carrie, that's one of the things that they're discussing right now. In fact, we've been highlighting it in an education conversation here each day, a little earlier in the morning before us, so you could go back and watch that one. But they're really trying to define how that's going to look, and the due date to have all that in is August 7th. And I know that's a little late for folks who are already getting ready to send their kids back to school.
There would also be, just so you know, this is the public-facing data. I have no reason to not believe that was a double negative, but I have no reason to not believe that the AZDHS they are sharing the back end data, or at least a portion of it, with the Department of Education to give them what the actual numbers look like for school age kids. So that is data because of AZDHS's their very strict interpretation of HIPAA. They are not going to produce that data publicly, but between government entities that have intergovernmental agreements, they can produce that data back and forth. So I would not be surprised if AZ Department of Education has a lot more concise data on that area, or that age group than we will ever see.
Yeah. Let's see, what else do we need to get to today before we wrap things up? And if there are any last minute questions, we can get to those too. Overall, it was just kind of an interesting day, because we're kind of clearing that backlog so we can trust a few of the numbers a little bit better. We're really going to have a better idea once we get to Monday and Tuesday, and we've been waiting so long for this to happen, because every time, Garrett, when we look at some of these numbers, it's like, okay, these are the numbers, but can it be trusted when you've got all those cases sitting there?
Yeah, exactly. We're going to be the next couple days. Tomorrow, every once in a while, even though we don't do this on Friday, Saturdays can be a surprise sometimes. We have had death records. We have had case records on Saturdays. So we're going to be watching tomorrow, obviously, to see what the movement is like. At this point, the most important stuff, like you said, clearing the backlog. Hopefully, and my understanding, but I think I already said this, but we'll probably see the backlog cleared by Tuesday. That doesn't mean it hasn't been cleared already, but we won't be able to observe it until Tuesday. So that the percent positives here on out are going to be super important. They've always been super important, but really super important, because they're going to be more reflective of what's happening in the last 7 days rather than what's happened over time.
Yeah. And then the other thing I wanted to highlight very quickly, we had some of the clinical trials that were starting, and they're starting here in Arizona. So those websites, if you're interested in taking part, the Hope Research Institute is doing one of them, which is HRI hriaz.com. Once again, for those of you interested, hriaz.com. And another trial that's just about getting started and has not just yet is cctresearch.com. cctresearch.com. So if you're interested in being part of getting a part of the efforts to get us closer to a vaccine, those are two places that you can do that right here in Arizona, and really, gosh, help us all. Your sacrifice in that helps us all. Let's see. I think that might wrap us up for today, Garrett. I do want to say that even though we are not with our friends here on Facebook and on YouTube when the weekend hits, you still pull some of those numbers, and they can find the very latest information on Saturday and Sunday mornings from Garrett's Twitter account. I always retweet it. Garrett's Twitter account is he's at Garrett_Archer. I think the really two helpful things are a look at the hospital snapshot that you do, and I'm happy to see you using that down arrow a lot more because it means that we're trending in the right direction for those. And then also for our overall test results and all of the numbers coming in. So there's his Twitter account. You can find him there. Lana writes, thanks for interacting with us. Lana, thanks for joining us on here, and thanks for your considerate and thoughtful comments as well. Mariah writes, thanks for the great information. We're happy to help. That's why we jump on here and want to help you better understand the numbers. We want you to be empowered with the numbers to make decisions for your own life. You know your family and their health situation best, and we're not here to make those decisions for you, but we are here to help you find the info. Debbie writes, I don't have Twitter. Okay, Debbie, find us on Facebook. I'm on Facebook at facebook.com/news from Katie. A lot of you have joined me over there, and I appreciate us continuing the conversation there as well. If you ever have questions, post them to me, and I'll try to get back to you on those. And we'll meet back here on Monday, talk about even more numbers as we get them in. We'll have a closer look at the weekend and how those numbers look. And what else did I forget, Garrett? Oh, any of our latest reporting is on our website, abc15.com/coronavirus. Arthur says, keep it up. Arthur, we're happy to help. Thank you for cheering us on here, and we appreciate all of you joining us on here today. We will see you in our newscasts at 4, 5, 6, and 10 p.m. And I'll be anchoring this weekend, Garrett. So if anybody's bored and wants to catch up with me on Saturday night, we'll have those newscasts for you as well. Everybody stay safe out there.